Hello, everyone. I would like to welcome you all to yet another episode of the Journey to Healthcare. Today's episode is going to be all about optometry, and we have Dr. Constadina here with us today. So, would you like to introduce yourself, please?
Yes. Hi, I'm Constadina. I'm an optometrist. I'm practicing in New York City. I graduated 2020, so I'm still kind of new. It's been 2 years out. I'm at a community health center in Brooklyn 4 days a week, and then I also float around a couple homeless shelters in Manhattan. It's been great. I love it.
Yeah, all right. So, would you like to tell us what is optometry?
Yeah, so optometry really is primary eye care. I tell my patients whenever they come and sit in my exam chair, I say, we're going to check your vision. We'll see how glasses will help you, but then we're importantly going to look at the health of your eyes. So it's more than just vision. It's more than just 20/20. So we're also doing like ocular surface disease. We're also looking in the posterior health of the eye. So checking for things like glaucoma, retinal tears, things like that. I dilate all my patients to make sure everything's healthy. But we really are kind of like the gatekeepers of primary eye care providers. If we find more serious issues that need surgery or things like that, we will refer to ophthalmology. But it's really vision and ocular health. So all that in one.
Okay, lovely. So, what is the path to becoming one?
So you do get like undergraduate requirements that you need like all your basic science classes. It's very similar to pre-med. And then most people do 4 years of undergrad. That's what I did. Some people can get away with doing 3 years if they get all the requirements for certain programs. And then you apply to optometry school. There is an optometry admissions test to get in, similar to MCAT. And then once you're in optometry school, it's 4 years. So 2 years of heavy academic classes. Third year, you're more in clinic at your school. And then fourth year, you go on externships. So you have the opportunity to go to different locations to do clinic. So 4 years. You can do a residency if you want. It's optional. I did not do one.
All right. So that means there are further specialization in the field.
Yeah, there's a lot you can specialize in. Yeah, you don't necessarily need a residency to even specialize. It's just more like credentialing or more, I guess, learning for that part. So you don't have to do a residency. It's awesome if you do, but you don't have to. There's a lot of specialties. There's like contact lens, vision therapy, sports therapy. There's retinal disease, glaucoma. If you go more towards like the medical side of things, things like that. There's a lot.
All right. So would you like to take us on what's a typical day like for you?
So I mostly work 4 days a week at the community health center, which is unique in itself because it has almost every other healthcare provider that you could think of there. So I'm the only eye doctor there. For example, there's adult medicine, pediatrics, dental, OBGYN, podiatry, everything there. So that's really nice. So I have access to all of my patients' health records, really. And so typical patient, they'll come in, we'll do history, pre-testing, we'll see why they're there, when was the last time they had an eye exam. A lot of my patients actually, because it's a community health center, it's more like lower SES, less access. A lot of times it's their first eye exam ever, and they're well into their 60s. So we do good history. We do glasses first, see how that can help them. And then that's when we go into looking at the front of the eyes. I measure their eye pressure, and then we dilate the eyes. So that's going to keep the pupils large so that I can look at their optic nerves, their vessels, the tissue, look for cataracts, things like that. I do also have a lot of imaging tools. We have a visual field to test for like peripheral vision. We have an OCT, which is test the retinal layers in the back of the eye. Really, really helpful for glaucoma, which the population I serve has heavy glaucoma. So that's a typical day. So I'll see maybe like over 10 patients for sure, but we're doing full eye exams on them. We also provide glasses for the patients as well. So we'll fit them for glasses too.
All right. Seems like a very interesting and interesting field actually. All right.
Yes.
So why did you choose this path?
I really, even when I was little, I just thought vision was so wild.
Oh,
I was just so aware of just the concept of vision. I also, for various reasons, was like hyper aware of the possibility of not having vision. For some reason, as a child, it stuck with me. I always wanted to do something in the healthcare field. I've never even needed glasses myself, but my dad, he always took me and my siblings to get our eyes checked every year simply because he had the means to do so. So he kind of instilled in us the importance of just overall health. So that stuck with me. I still think vision's crazy. I studied it so much. I'm still just fascinated by that concept. I really think helping improve someone's vision will improve their quality of life no matter what state they're in. So that just really motivates me every day. I love it.
fantastic. All right. So what's your favorite thing about the job?
My favorite thing, I do think optometry is a great healthcare field because of that patient-doctor relationship. You really do have a lot of face time with your patients. We're doing so much. You do get a chance to develop a great relationship with them. You hear about really anything. It's so subjective. That's the thing. We have to take into consideration the patient's perception of the world, their subjective perception, and we need to objectively and subjectively improve it for them. So I do feel like it's a lot of building a relationship with the patient, which I think is a little bit unique to other healthcare fields, just because we have all that time with them in the exam room. And again, I just think it's so cool to help someone see like this beautiful world. Like I've seen it firsthand, like when we give them their glasses, even little kids, like their moms and dads, like don't even realize that they can't see. So it's just an awesome thing to be able to provide that for them. I truly feel like fulfilled every single day. So I feel lucky to do it.
That's fantastic, really. I think also like in many of the interviews I did, it's like the gratification of these healthcare fields is a really, really big factor. So that's great.
Right.
Uh, what's the least favorite thing about the job?
It's so funny because I keep circling back to my other answers, but it does get frustrating sometimes when we do have to deal with like the subjective side of things,
Mm-hmm.
or if patients having a hard time communicating like exactly their perception or how it's going to help. Aside from that though, I do find a lot, and I know you're going to ask this question later on in the interview, but I do think there's a lot of misconceptions about the field, about glasses making your eyes better or worse, about even needing eye exams. So I do feel like I'm constantly having to educate people on that. Not only my patients and like general public or whatever, but I do have to advocate constantly for the optometry department at the community health center. I do feel like it's a field that a lot of people don't know about unless you're actually in the field. So I actually spend a lot of my time advocating for myself and my patients. So that can be frustrating, but it's a good experience for me, and I'm happy to do it. But I would say that's one of the things that's a little bit frustrating about the field.
Yeah, I think there's like many. I think there need to be more awareness about the field of optometry because even when I was like looking online, I me myself, I learned about the field online before I actually.
Wow.
Yeah, so I would love like later on that it will be more and more known, you know, and
Yeah.
yeah.
Well, and that is what's incredible is that people like you who are in other realms of the healthcare fields can play a huge role in raising awareness.
Mm,
At my community health center, every single patient that has diabetes, so to be seen by me, you have to be a patient of the center.
mhm,
So I can see all your charts, your basic physicals and all that. Every single patient with diabetes gets referred to me.
mhm.
Every single pediatric patient who fails their vision screening gets referred to me. So that's a great step, but that's just in my little world of the community health center. But other healthcare providers can continue to advocate that on the side to their patients. So when you know that they have systemic issues that can affect their eyes, always saying you really got to get your annual eye exam. Everyone needs an annual eye exam, but especially certain patients.
Yeah, for sure. All right. So what is the most interesting case you've encountered, of course, without breaching patient's confidentiality?
I feel like it's hard to pinpoint just one. I do feel like there's maybe like an umbrella of cases that I see actually often that I think is a public health issue. I see a lot of end-stage glaucoma where the patient has no idea that anything is wrong. You don't know until you like tip over the edge of glaucoma, but once I see it at end stage, it's almost too late. I see a lot of that. So it's a lot of, again, the patients that are in their 60s and it's their first eye exam. So that's pretty sad, but that just shows that we really need to be pushing for all of our loved ones to be getting their eyes checked regularly. I see a lot of that. I've seen eye pressure that's just been ridiculously high in one eye. And I went searching. Again, it's great. I get to see all my patient's records. I went searching in his records and he was given steroid drops, PRN as needed for years and years and years and years, and without being seen by an eye doctor. And so it just things like that. Cases that could have been prevented. I see a lot of that. Preventable vision loss. I see a lot of like toxoplasmosis scars. I see a lot of very mature cataracts that simply need cataract surgery. And yet they've been living with this blindness for so long. Things like that. I refer a lot to ophthalmologists, but I do see those kinds of things.
Yeah. As you said, it's kind of upsetting because a person could optimize their quality of life if, you know, as you said, like annual eye checkup and just generally health checkups as well as like
exactly.
if they can, yeah, like they don't have to live like that. They could.
It's preventable, yeah.
Yeah.
It's preventable.
Yeah, for sure. So what advice do you have for aspiring optometrists who's watching this?
I would say really just think about like what your like why is for the field. Like, why do you want to do it? And really hold on to that, because it's so hard to be in any sort of professional in the healthcare field. So you really got to hold on to what's your why to keep that motivating you, but more importantly, to help you focus on what you really want to do so that you get fulfilled out of your career. So my why was that I love like the public health side of things. And so I ended up getting jobs at a community health center and homeless shelters. So I do think just keeping that in mind is going to help not only motivate you, but like really help the universe place you to like where you're meant to be. It's tough. I had a hard time in grad school academically. It was really tough. And I love talking to students about that because we never really talk about our failures. We just talk about our successes. But I have failed in my career leading up to becoming an optometrist. So it's important to know that there's other people like that and that it's not the end of the world. And you just got to keep pushing.
Yeah. And thank you for saying that, because as you said, yeah, it's like, people just don't like to talk about it, and it's actually the reality of many students in different fields, really. Yeah, but we like to put the highlights more than the everything. Yeah, the full picture, you know. Yeah. All right. Okay, so thank you so much for taking part in this. I really enjoyed it, and I learned quite a lot about the field, and I wish you all the best.
Thank you. Thank you so much for including me. I think this is incredible. So I feel honored to be a part of it. So thank you.
Thank you.